Hello, I'm Susie Muhammad. Welcome to this edition of EC3 HOSA Medical Moments, a monthly program featuring knowledgeable healthcare professionals and guests talking about health topics and tips.
My name is Nia Sims. Susie and I are EC3 HOSA students. Our show is produced by HCEC-TV with talented support from our community partners. Good morning, Ms. Parker. Could you tell us a little bit about yourself?
Yeah, I'm a registered nurse. I've been a nurse for over 16 years. I graduated from the University of Kentucky with my bachelor's degree, and then I went back to school, and I have a master's in healthcare administration and business administration from Webster University. Most of my time was in intensive care when I was a nurse at the bedside, and then I made my way into nursing leadership and made my way here to E-Town at Hard Memorial Health about 3 years ago.
Okay. Wow. Please tell me about your role at HMH.
Yeah, I am the Assistant Vice President of Emergency Services at HMH. I oversee and provide leadership to the emergency department, and it's one of the busiest in the state, so that's a very time-intensive job. And then I also provide leadership to the urgent care clinics here that HMH has. We have 2 right now, and also work as a liaison with EMS in the hospital.
Okay. And how does health and individuals' overall health relate to emergency services?
Well, being healthy is not just about not having an illness or being sick. It's about being well in general. The goal of maintaining good health will be that you can prevent the need to come to the emergency room or to an urgent care and seek medical treatment.
Mm-hmm. Can you define primary health care provider?
Sure. Most of us know a primary health care provider as a physician, or what is known now as an advanced practice clinician, which you may see titles such as a physician assistant or a nurse practitioner. Those 2 are examples of what an advanced practice clinician is. And a physician and maybe a nurse practitioner would be an example of somebody you would see in a primary care clinic. And they are there to partner with you or the patient that they're seeing to monitor them from looking at what type of risk factors they may have for any type of chronic illnesses, and also do screening and wellness exams. Also, what somebody may just refer to as, I've got to go for a checkup. Mm-hmm. So.
And why is it important to establish a relationship with your primary healthcare provider?
It's important to establish that relationship because they are going to partner with you on ways to create and maintain a healthy lifestyle. Mm-hmm. Have discussions with you about fitness, about maintaining your strength for your bones and your heart health. Mm-hmm. Discussions about not smoking. There can be a lot of consequences with that. And really overall working with you on a plan to make sure that you can stay at your healthiest and prevent the need for medical treatment.
Okay. Mm-hmm. In discussing emergency care, can you please explain the type of visits that are appropriate for the emergency room?
Yes. So emergency care is really when you're having an emergency. So it's those life-threatening critical moments. Mm-hmm. Good examples of that would be if you're having chest pain, potential heart attack. If you're having slurred speech or numbness on one side, which could be a sign of a stroke. If you've been in a car accident and had some type of a trauma. If you've had a major fall in which we would need to evaluate you if you've got large lacerations or cuts, broken bones, seizures, those types of, those are examples of a condition or injury that you would want to seek medical treatment.
Okay. And I understand Hardin Memorial Hospital also has urgent care clinics in the community. So can you elaborate on the urgent care services and the types of visits applicable?
Sure. And that's sometimes a confusing thing for people because emergency and urgent both sometimes make you feel like, which way do I go?
Yeah.
But from urgent care, you would want to go to an urgent care for similar things that you would actually go to your primary care physician for, but maybe it's after hours and you can't get in, or your doctor is booked up for a couple of days. Mm-hmm. These are going to be more minor injuries. So a cut that's not a really deep cut, coughs, colds that are, maybe you're concerned you have flu. Mm-hmm. Those types of things, a potential, if you've got a urinary tract infection, something along those lines would be really appropriate for you to go to urgent care.
Okay.
In summary, can you differentiate emergency care versus urgent care?
Yes. So again, if you're in a situation where you're experiencing something and you need to seek medical treatment, emergency care is going to be those life-threatening, limb-threatening, you'll hear sometimes too, eyesight concerns if you've lost sight, those really critical high-level needs in which you're going to need to go to an emergency room that's going to be equipped 24/7 with the ability to treat that type of concern. Urgent care, again, is something that you would feel comfortable seeing your normal primary care physician. However, you may not be able to get into an appointment in a time frame in which you need it. It's those after hours if they don't have that. So you need to see a physician, but it's not a life-threatening situation.
Okay. And what happens when individuals are not using emergency services appropriately?
Well, we see that a lot. That's a nationwide concern. What happens there is you will see greater wait times in emergency rooms because you're going to have a larger group of people coming into the emergency room, and it may not be for an actual emergency. You'll hear a lot about waiting rooms being full and long times to see a physician. So it can really slow down that care that someone that is having an emergency if we've got everybody going to the emergency room from that perspective. There's also financial implications for that in regards to it's a higher cost to go to the emergency room as opposed to going to urgent care. So it's those types of things that are a challenge if the emergency room is used inappropriately.
Okay.
Sometimes in the community there's a concern about wait time for the emergency room. Can you explain wait time in the triage system?
Yes. So I think what everyone needs to understand in the difference from emergency rooms and why there are wait times is it is the job of the triage nurse or the actual physician or healthcare provider to triage people, meaning when they present to the emergency room, they have to treat the most life-threatening situation first. Many times I think there is confusion and that if I've signed in before someone else, I should actually be seen first. And we get that a lot, but it's no different than in a disaster situation. It's even very similar to how the military, if you have an influx of patients, you're going to have to treat those that have the greatest need first. And so that situation is how we assess those patients, and then we assign an actual triage level to them, so that way we know who needs to be brought back immediately and who has a less life-threatening situation and can honestly wait to receive care. And so I think a lot of times there's just not a good understanding of that. And so it can cause frustrations. But I will also say, I think people don't necessarily realize you're going to be in the emergency room. Generally, an average, if you look at from a nationwide perspective, 4 to 5 hours. You have to think about the fact that you're going to potentially need x-rays or CAT scans, things that are going to take time for us to get those results back. And again, that's why I would say if it's something that's not life-threatening, you're looking at more of like an hour turnaround time if you go to an urgent care. So hopefully that helps explain it a little bit.
So we're aware that Hardin Memorial Health has gone through some expansions recently. Can you tell us about some of the additions?
Absolutely. So the emergency department, as I mentioned, is one of the busiest in the state. So we saw over 73,000 patients last year, and so there was definitely a need to expand so we could better serve the community. We're seeing pretty much over 200 patients a day. So what happened is we went from about 27 rooms to 65 rooms. So that way we have more rooms to treat patients. We also, of course, from that had to add additional physicians and nurses to provide that care. And all of our physicians are board certified in emergency medicine, and they're an amazing team. But when you add more rooms, we had to make sure we had enough bodies there to take care of those people. So we've definitely brought on a lot of new staff, and they are excellent, and we're very happy to have them. Along with that expansion, we were able to designate some specialty rooms for our patients. We have 2 SANE rooms, and what that is for our SANE program, which is Sexual Assault Nurse Examiner Program. So we have 2 rooms that are dedicated to those that may have experienced a sexual assault and would require a very specialized exam. Those exams can take hours. It's gathering evidence. It is truly forensic nursing, and it's a huge blessing, honestly, for this community. And it's a service that isn't provided everywhere, and so I'm so thankful that we have the ability to do that, and that we can do it in a manner that really respects the condition in which they're coming in for. These rooms allow for more privacy than others. It's a very difficult thing for someone to have to go through, so we really made sure to take all of those thoughts in. Our SANE program in general has been growing tremendously. We are now one of 8 hospitals in the state that is a certified SANE-ready hospital. And what that means is that 24/7, if someone presents to the emergency room in need of an examination from a sexual assault, we are able to provide that for them. So it's something we're extremely proud of. And so it's a growing program. We have 17 SANE nurses right now, and it's pretty impressive. Along with that, we also have 4 dedicated behavioral health rooms, or psychiatric rooms is another way that some people would refer to it. We're seeing an increase in our patients that have mental health needs, and there is definitely a lack of access to mental health care throughout the state. And so we make sure that those rooms are very safe. Things that we have to worry about is that there is no ability, we call it anti-ligature, so nothing that they could potentially hurt themselves in the room on. And so those rooms, we have 4 of those. So that's something that we're really glad that we have that ability to help provide that as well. We also, with the expansion, put in a CAT scan right directly into the emergency department, and an x-ray. So, and those types of equipment are really important for us to be able to get the testing that we would need. And I'll say, for instance, a stroke patient. Now, if we have a stroke patient that comes in by ambulance, and even if they come in by private vehicle, we will immediately take them to the CAT scan, because that's the first thing they're going to need. Is they're going to need an image of their brain, so we can determine if we're going to give them life-saving medication, which is extremely important for us to know. And because of that, and having that equipment in there, we've had some amazing outcomes for our patients, and the ability to really ensure that we're getting the medication in as fast as possible. In healthcare, you'll hear people say a lot, time saved is brain saved. So the faster we get the medication in, the better the outcome for the patient. So it's pretty remarkable, the things that this renovation and expansion has been able to do for the patients that we serve.
And you said there was an expansion, so you have more nurses.
Can you ask that question again? Sorry.
Sorry. With the expansion, you said there were more physicians and nurses added on. How many physicians would you say were added on to your team?
I believe that we've added on 2 physicians and I believe 4 are advanced practice clinicians, in which one of those is a physician assistant, and then additionally the others are nurse practitioners.
Okay. And then for the SANE nurses, the forensic nurses basically, do they have to go through any certifications or anything, or is it just basic training and hands-on?
That's a great question. They do have to go through a very in-depth education in regards to that, and there is a certification so that they would have to actually perform and test out of the skills that they have been taught. Mm-hmm. They also have to perform a certain number of exams with someone that is overseeing their care, okay, and be signed off in order to actually achieve that certification. So it is a very in-depth training, mm-hmm, and they also have requirements throughout the year of where they have to obtain a certain number of education credits, mm-hmm, to maintain that certification. So it's they're very equipped from a knowledge perspective and definitely experts in their field.
Okay, and then you also did mention the mental healthcare, like the mental rooms. Mm-hmm. How is that, I guess, different than maybe Lincoln Trail or whatnot? Are the stays obviously shorter, or what's the process through that?
Yes, the stays are definitely shorter. Many times we have patients that are coming in that are experiencing a potentially life-threatening situation, but also have a history of mental illness. Okay. So we want to make sure that we are understanding their condition and what they have and can still keep them safe in a room. There's also, though, those that come in a mental health crisis. Okay. And so in that situation, we are placing them in those rooms, providing any necessary medical treatment right away at that time, and then partnering with our social workers within the department to reach out to locations like Lincoln Trail, okay, Communicare, and others to move them into one of those locations so they can receive more treatment.
Okay.
Thank you for your time. We appreciate you coming here to talk to us.
Thank you. I appreciate the opportunity.
And we encourage everyone to seek the appropriate health care and work with their primary health care providers. Thank you again. HOSA used to stand for Health Occupational Students of America, but now it's just HOSA, Future Health Professionals. We are the students that plan to be in healthcare in the future and want to enlighten and give knowledge to our community about healthcare.
Thank you for tuning in to EC3 Medical Moments. See you next time.